postpartum period. Okay, because different question in exam comes to relating to this topic. So if the patient wants contraception immediately after birth, then we would tell her that contraceptive depot injection and implant are safe. Okay, although they have certain side effects as well, but we can offer these two types of contraception to her: the contraceptive depot injection or the depot provera, which comes in the dose of 150 mg per ml, or we can offer her the implant, the implanon. Okay, now within 48 hours after birth, okay, patient has given birth to the baby, and within 48 hours we can prescribe her the IUCD or IUS. Okay, IUS is basically the hormonal intrauterine system, which is basically Mirena, and copper IUD can be prescribed to her. PPIUCD can be given immediately after birth. Okay, and if we don't prescribe this PPIOCD immediately after birth, then we have to wait for the 4 weeks. Okay, then sometimes the question comes that patient is after 3 weeks and she's not breastfeeding. So in that case, what we have to give? We can give her a contraceptive patch or copper IUCD, because both contain not only progesterone but also ethinyl estradiol or estrogen. Okay, so the combination of estrogen and progesterone can be given after 3 weeks of gestation if the patient is not breastfeeding. But if the patient is after 3 weeks of gestation and she is breastfeeding, then in that case, rather than going for the combined preparation, we have to go for the POP, which is basically the progesterone only pills. Okay, now coming to the choice about 6 weeks postpartum. In that case, it would be better if we prescribe to her the diaphragm and cap. Okay, and if the patient wants sterilization, then sterilization via mini laparotomy after 6 weeks postpartum. Diaphragm and cap, 6 weeks postpartum, yes, that is the better choice. And if she wants sterilization, then sterilization via mini laparotomy, and definitely 6 weeks have been passed, so we can give her COCP as well. But the thing is that if she wants sterilization, then she has to wait for 6 weeks postpartum. Okay, and any time after birth, it is the beauty of POP that it can be prescribed any time after birth, but preferably it should be prescribed 21 days after the birth, or it means that after 3 weeks of after birth. Okay. Now that was just the few points from the different MCQs which come in exam. Now come to the Macri as well. Okay, this point, postpartum and breastfeeding contraception of choice from the Macri needs to be discussed. Okay, like if it's written in the Macri that if the patient is less than 48 hours after birth, then the best choice would be copper IUCD, as I have told you before. And as far as the levonorgestrel intrauterine device and implant and POP are concerned, these are the second choices. And third choice is that of the DMPA, which is dipomedroxyprogesterone acetate, and the pills which contains the hormones combined preparation. Those are the last choices, the fourth one. Okay, now if the patient is within the time frame of 48 hours to less than 4 weeks, means 4 weeks time period has not been passed. So in that case, if we ask about the best choice, that would be POP and implant. As you can see, there is no number 1 choice, but number 2 choice is POP and Mirena. Okay, number 3 choice is that of the copper IUCD DMPA, and the 4th choice is that of the combined preparation. Okay, now if the patient is 4 weeks postpartum to less than 6 weeks postpartum, in that case, the first choice would be copper IUCD or levonorgestrel intrauterine system. Okay, the second choice would that be implant and POP, and the third choice would that be injectable DMPA. And the 4th choice would that be hormonal containing pills, means combined preparation. Now, if the patient is in the 6 weeks postpartum to less than 6 months, then all the types can be given except the combined preparations. Okay, 6 weeks have been passed, less than 6 months time is there. So the first choice would be other contraceptive methods, and the last choice would that be combined preparation. Okay, so that was just an overview of the different types of the contraceptions which are prescribed in the postpartum period. Thank you so much.